Well, thanks for coming this Saturday morning. I'm glad that the weather is not too bad. My name is Eric Chow. I know I've met some of you before. I'm one of the pediatric oncologists here at Seattle Children's and direct the survivorship program here. And we're really excited that we're back in person after a few years hiatus, and that this is our sixth Moving Beyond Cancer to Wellness session. And before we get going, just want to make a shout out to our sponsors, some of which have their brochures either in this room or outside. But the National Children's Cancer Society, which has generally funded this event for many years counting, the Leukemia and Lymphoma Society, who has a booth out there, and the Sarcoma Foundation of America. And also just want to make sure that people are aware that there are several tables further down the hall as well, since they didn't allow us to put them all in the front. But Cancer Lifeline, Camp Good Times, and Cancer Pathways are to the right of the auditorium, and encourage you, if you haven't seen those, to make your way down there. And then there's also some tables up here on this left side as well. And then I also want to make sure that we have an opportunity to give the Cancer Blood Disorder Center Family Advisory Board a chance to kind of introduce themselves and say a few words. So I think we have Michaela and Julie here on their behalf.
Hello, I am Michaela.
And I'm Julie.
We are on the Cancer and Blood Disorder Family Advisory Board. If you haven't heard about us, you can stop by the raffle booth out here, and we have a sign-up sheet, and we can send you some more information about the board. But I'm going to just read our vision statement so that you can know what we do. Our goal is to improve the hospital and treatment experience for the patients and families, and to provide a system of support to newly diagnosed families and the hospital's hematology and oncology community, connecting parents to resources, community, and opportunities to be involved. So we meet quarterly, and we meet with, there's a bunch of different parents, and we meet with different hospital staff at each meeting and talk about different ways that we can make things better for our patients. So we would love to have you join. Looking for new members. And sign up for the raffle.
So the raffle drawing will happen at the end of the session today around 2 o'clock, is that right? 2:30? Yeah, so that's encourage people to stay for the entire event if possible. If you don't already know, we'll have lunch provided as well. And just to make a plug, having done this, I guess, 5 times already and seen it at other children's hospitals as well, we have a patient panel. That'll be the thing right after lunch. That by far, I think, is always the most amazing experience that most participants always report. So that's another plug to stay after lunch if you have time. And then this is just a reminder that we do have event evaluations. Those were at the check-in desk. And I really encourage people to fill those out and give us feedback, because that's how we take into account how we plan future events. So we try to have these about every 2 to 4 years if possible, and so we really take into account prior feedback. So with that, I'll just give a short introduction before I switch over to my colleague Neil Bott, who will talk more about educational outcomes and reintegration with school after treatment. But just as a brief few words, I just want to point out that long-term survival after childhood cancer has really improved over the decades, as you can see here. But really our goal is to bring that even further, right? So people treated in the current century, we really want to see doing even better. We know that there are potential issues, especially in children, because they're growing at the time of both cancer diagnosis and treatment, and it affects a variety of different organ systems like the brain, the hearing, heart, lungs, fertility, and bones, and some of the things that are particularly associated with effects on those areas are listed there. I'm not sure if people can all see the slides, especially if those of you sitting right there who may be blocked. But intrathecal chemotherapy, surgery, the tumor itself can have effects on the brain. These drugs like cisplatin, called platinum agents, have profound hearing issues. For heart, drugs like anthracyclines, which are mainly like doxorubicin or daunorubicin, for example, have effects on heart function. And then for lungs, bleomycin and busulfan. And then for fertility, alkylating agents like cyclophosphamide or ifosfamide. And then we know steroids also have effects, especially on bone density. For those that have been treated with radiation, that does have effects on all these organ systems, depending on where the radiation dose was delivered, of course. So for radiation specifically, we do want to make sure people are aware that we do screen for potentially future cancers, and that includes brain tumors with a history and exam, thyroid with an exam to look for nodules. We have recommendations for early breast cancer screening if you've had chest radiation in girls and women. That includes mammography and chest MRIs starting at age 25, which is different than what people in the general population get. And then if you've had any abdominal radiation, which can include spinal radiation that was delivered prior to using proton therapy. So you've had photon therapy, the old-fashioned radiation for spine, brain tumors and spine lesions. People will also get recommended colorectal cancer screening starting at age 30. And then we want to make sure that people are aware that it's important to just have an annual checkup just to check for moles and things like that. And then, Seattle Children's now has much more enhanced genetic counseling services, so we do strongly advise people to consider talking with a genetic counselor, even if there's no family history of cancers, especially for certain types of cancer types. So I think it's important, even though we're talking about all these potential things, is that no one gets all these problems, and really most people will lead healthy lives, but it's important to be aware of these things so that we can try to prevent and detect things that are happening earlier. And so I kind of want to talk a little bit about moving from cancer patient to survivor. And I know that there's a mixture probably of people who are here. Certainly some families who have more recently finished their treatment experience will maybe identify end of treatment as a time of new uncertainty, potential frustration, even stress. And this is a quote that was given a few years ago, but by someone, by a family here, who said, we lived with all these people. This is the hospital team for many months, and then they say, okay, you're done. We'll see you in about 3 months. But for this family, and I think that's not a unique experience, this is not really over for them, right? Just because they finish treatment doesn't mean their journey ends. So I think this transition period from finishing treatment to survivorship care can be challenging for some people. There's a lot of changes. You go from your oncology team and pediatric care potentially to having to go back to primary care, who you maybe have not seen for at least a year or two or longer. For some patients who are older adolescents or young adults, it may be a transition from pediatric care to adult care, which has its own challenges. I'll talk about that in a second as well. And then what is this normal that you're now facing? It's certainly not what things were like before the diagnosis, but trying to get back to some semblance of normality. What we can do to help is at least teaching families and patients about follow-up and things to watch for, which will hopefully decrease some of the stress from this transition. So we know from prior studies, and I think it's still accurate today, is that many people have a limited knowledge of their past history, especially children treated at a young age, where they may oftentimes not even remember all the details or even the experience, especially like treated during infancy or toddlerhood. And so when this study was done about 20 years ago, they surveyed adult cancer survivors who were treated as children. And most, 91% knew that they had what their diagnosis was. 72% actually had detailed knowledge of that. 2% reported that they only had cancer but didn't know the diagnosis. And there was actually close to 10% that were unaware that they were previously diagnosed with cancer. When you ask people about their treatment exposures, that it kind of varies. Most people remember that they had radiation, just probably because it's more memorable, although not everyone knows what site received radiation. Chemotherapy tends to be a lot less memorable because it's just one more bag of something hung next to an IV pole. And so when you ask people about things like anthracycline chemotherapy, which are associated with a variety of late effects, including heart issues, more than half weren't aware that they had received that. And then when asked about certain types of surgery, for example, splenectomy, which is when your spleen is removed, most people were aware of that, probably again because surgery is pretty memorable, but other than having a scar present, many people weren't necessarily aware that what their surgery was. So there's certainly large gaps in knowledge across these domains. So what is the value of comprehensive survivorship care? What we try to do is review the past history and also screen for recurrence. We want to review potential treatment-related issues, many of which can be preventable or treatable. And really, the goal is to increase patient and family awareness and knowledge, and also increase adherence to recommended screening. And the hope is, by doing this, we empower both patients and their families to kind of be champions for their own care. And this is data from one center, which really shows that at baseline, which is the blue bar, patients' awareness of their own health risk really was pretty variable and for the most part pretty low across multiple domains. But after having at least 3 visits at a survivorship clinic, you can see that the knowledge base really improved. Not quite 100%, but you can see that there's a dramatic improvement across all these domains. So just to want to mention that we have these very detailed guidelines that we and other centers across the US and Canada follow to kind of guide us and make sure that we're having standard long-term follow-up care for all patients, whether treated here in Seattle or treated elsewhere and people move to the Pacific Northwest. This is probably a bit small, but there is a website, survivorshipguidelines.org, where you can go. Not that you really want to spend time reading these guidelines yourself because it's very dense, but they have a lot of family, patient-friendly handouts that we also give you in clinic, which you can download about various topics. And if you're like learning a second language, if you want to practice that, they have it available in multiple other languages as well. I think French, Spanish, Chinese are 3 that come in mind besides English for most of these handouts. We want to mention one thing about survivorship care plans. This is really your roadmap for care, and we update these after each appointment. And what it has, if you haven't gotten one of these before, is it provides key details in a very succinct format of your cancer diagnosis and treatment. This includes cancer type, location, years of treatment, what chemotherapy people received, the doses, if you had radiation, what the doses and areas treated were, and if you had any surgeries. And then the second section usually provides a personalized overview of key issues related to your prior treatment based on your own individual history. And then lastly, there's a personalized follow-up plan, what labs you need, what imaging or other studies you'll need in the future, any referrals, and future appointments. And the hope is within these first just few pages is a document that's doesn't require you to memorize it, but something that gives you an outline of what the things that you want to watch for and the things that we're doing to help you watch for those are in the future. You can certainly share that with your primary care provider or any future healthcare providers. It's certainly a lot easier than giving people a really thick, 2-inch notebook that you might have kept of all the labs and test results and every documentation that you received during treatment, because that's too much to digest. So just a couple points about transitioning to adult care. I think that can be challenging on both the part of the pediatric team as well as patients and families about letting go. So I think there are some tips on how to do that more successfully. It really means starting the conversation early, not that you're going to transition at age 14, but if you start talking about it, by the time that actually happens at age 18 or 21 or 22, we've been talking about it for many years and it's going to not be so scary. So it's important to discuss that both with your oncology team as well as primary care. It's important to figure out if you're going to need adult subspecialty care and where to get it. Adult care tends to be more fragmented than having everything, say, at Seattle Children's. So it's important to figure out kind of who's going to be the endocrine doctor, who's going to become the cardiologist, those type of things. Insurance is a complicated topic, but for many patients, you can stay on your parental insurance about age 26. But if that's not the case, then making a plan about how to adjust that. For some families, there may be guardianship issues that would be applicable once the child becomes an adult at age 18. It's important to have a copy of your survivorship care plan, and then getting electronic access to your medical records is a good thing to set in place. So just want to, many of you have been to this program. For those of you that haven't, we have a dedicated survivor program at Seattle Children's where we have a variety of providers, both physicians and nurse practitioners, nurse coordinators, team coordinators who help with scheduling, psychologists, a couple of whom are in the audience and will be giving sessions today, our social worker, Brianna, and we also have a genetic counselor, Natalie Willigorski. We have clinic in Seattle 4 days a week currently. We also have clinic in Bellevue, Everett, Federal Way, and Tri-Cities. So if any of you live closer to one of those locations, we certainly could see you there instead. We also offer telemedicine services, which are obviously available for anyone in Washington State, but it's also especially useful for people living in Alaska, Idaho, and Montana, who obviously would have a harder time making it to one of these clinics. And then what happens when you graduate? We do have an adult survivorship clinic at Fred Hutch, so just down the street. A lot of that services can be available by telemedicine as well. And what we do here is we graduate people from Seattle Children's, usually around sometime between age 18 and 21, depending on what the family and the patient's preference is. Or if someone's in college, we usually say, why don't you, we'll transition you after you graduate from college, so whatever is later. It's staffed by Dr. Bott, who you'll meet in a second, and myself. So it's 2 pediatricians are seeing adult patients at this clinic, people that were treated for cancer as children. So you have full access to pediatric records. We have full access to pediatric records. We'll know your care from Seattle Children's. And so the idea really is, even though it's a different clinic, is to make it as seamless as possible. What is different is it's a consultative model, meaning that the labs and studies that we typically would order for you at Seattle Children's and the adult side need to be ordered by your adult primary care provider, which is one of the other reasons it'll be really important when people get older to have an adult internist or family medicine provider identified. So just to wrap up, here are our 7 tips for success. We encourage people to visit the survivorship clinic, or if you haven't done that already, you'll get a survivorship care plan, and you can share that with your other healthcare providers, especially primary care, which we'll also send to them as part of our clinic visit with you. It's important that if you're just finishing treatment and returning to school, to talk to your school about your treatment and what accommodations might be important. And Dr. Bott will talk more about that in a second. And then if you're age 14, like one of my kids is, start thinking about future transition. And then for the patients in the audience, you don't want to depend on your parents to organize your healthcare forever. So we're always really excited when we see like the 18 or 17 or 19-year-old show up by themselves to their appointment and say, yeah, my parent, they're waiting outside, it's just me today. Or sometimes they drive in themselves if they're 18 or over. So that's always a great sign that they're ready to take care of their own health care. It is important to take care of yourself. That means both patients and their parents, both mentally and physically, because we know that this experience for some can be draining in both of those domains. And it's important to good diet, exercise, and also not smoking. And then step 7 is visit the survivorship clinic again, because there is data, as I showed, that multiple visits is helpful to really kind of boost that knowledge base. So really the goal is we want people to leave Seattle Children's in good hands and have a good plan and feel confident about their futures. This is actually, this family obviously gave permission for their picture to be shown. This was one of our longtime patients. She went to college, came back and interned with us at Fred Hutch for research, and then is working in a lab now in New York City. So really great to see that.